Congo hemorrhagic fever, or CCFH, is a virus, particularly a tick-borne virus named norovirus. It is part of the family Bunyavirdae.
The history. The disease was first characterized in the Crimean in 1944 and given the name Crimean hemorrhagic fever. It was then later recognized in 1969 as the cause of illness in the Congo, thus resulting in the name of the disease. Mode of transmission. Ticks from the genus Hylama are a vector for the CCHF virus. Numerous wild and domestic animals such as cattle, goats, sheep, and hares serve as amplifying hosts for the virus. Birds can spread the virus to other regions.
Disease could also spread through bodily fluids and coming in contact with infected animals.
Mortality rates and studies. The mortality rates can be up to 40% in some countries due to there being poverty and the lack of medical assistance. In a small case study in Pakistan, they found that the mortality rates range from 10% to 50%, and that is without any medical assistance.
The Hyloma ticks, which are vectors that are responsible for viral transmission, are found in Africa, Middle East, Asia, southern parts of Russia, and parts of Europe such as Turkey, Bulgaria, Greece, and Albania. Incubation in humans varies by route of exposure. For tick bites, it's usually 1 to 3 days, but could go up to 9 days. From infected blood or animal tissue, this is 5 to 6 days, but could go up to 13 days.
Signs and symptoms, pre-hemorrhagic phase. A sudden onset fever, chills, a headache, dizziness, photophobia, neck pain, myalgia, arthralgia, nausea, vomiting, non-bloody diarrhea, bradycardia, and low blood pressure. The hemorrhagic phase. It is composed of a peculiar rash, ecchymosis and large bruises, the vomiting of blood, nosebleeds, blood in urine, and coughing up blood.
Treatment. There is no cure because it's a virus, but you can still survive. Treatment should include careful attention to fluid balance, a correction of electrolyte abnormalities, hemodynamic support, and appropriate treatment of secondary infections. The antiviral drug ribavirin is the only drug used for CCFH patients.
Diagnosis and prognosis. Laboratory tests that are used to diagnose CCHF include antigen-captured enzyme-linked immunosorbent assay, ELISA, real-time polymerase chain reaction, PT-PCR, virus isolation attempts, detection of antibody by ELISA, immunoglobulin G, and immunoglobulin M, and it is essential to determine the possibility of a fatal prognosis in CCHF patients using clinical history and biochemical parameters so that the necessary precautions can be taken.
Prevention. Avoid tick bites by using tick repellents, avoidance of tick habitat, wearing long clothes and check skin for tick bites, avoid contact with infected blood or tissues, and do not consume unpasteurized milk, obviously.